Protect your cognitive vitality by learning how to avoid risks. Diabetes is a metabolic disorder characterized by high blood sugar and more common than you might think. In the US, about 15% of adults have diabetes. While roughly a third show metabolic signs that they are on the path to diabetes, a condition called prediabetes, and most don't even know it. It's a condition where the body can't manage sugar levels in the blood the way it should. That sugar, called glucose, is what gives our cells energy. Insulin is the hormone that helps sugar move from the blood into your cells. Without it, sugar stays in the blood. When sugar builds up in the bloodstream instead of getting into our cells, it can cause serious damage. There are two main types of diabetes. Type 1 diabetes often starts early in life and isn't considered preventable. It happens when the body's immune system attacks the cells that make insulin. But most people with diabetes have type 2. In type 2 diabetes, the body still makes insulin, but the cells stop responding to it. This is called insulin resistance. Our cells need a certain amount of energy to function properly, but too much sugar can harm them. So, when we chronically consume more sugar than our bodies need, our cells undergo changes to try to protect themselves. The cells stop responding to insulin to reduce their uptake of sugar, but this ultimately ends up causing more harm. Because the cells no longer get their energy needs met, while the sugar trapped in the blood induces stress and damage throughout the body. The brain is especially sensitive to the stress of high blood sugar, such that the Lancet Commission lists type 2 diabetes as one of the top preventable risk factors for dementia. But here's the good news. Type 2 diabetes can often be prevented and sometimes even reversed. So what can you do? First, get your blood sugar checked. Excess weight is a risk factor, but even if you're at a normal weight, you could still have metabolic issues. One of the key risk factors for diabetes is a set of metabolic changes called metabolic syndrome. It includes signs like high blood pressure, high blood fats, and extra fat around the waist. Doctors typically diagnose someone with diabetes when their fasting blood sugar is over 126 milligrams per deciliter, or when their HbA1c, an average measure of sugar in your red blood cells, is over 6.5%. Prediabetes is when blood sugar levels are higher than normal, but not high enough to be diabetes. That's a fasting glucose level over 100 milligrams per deciliter, or an HbA1c over 5.7%. Catching it early is key. This is the stage where you can slow or even reverse the damage. But how? By making healthy changes like eating more whole foods, cutting back on sugar and processed foods, moving your body more often, and maintaining a healthy weight. Strength training is especially important. Muscle can act as a sink for excess glucose and help protect against insulin resistance. But sometimes, lifestyle changes aren't enough. When needed, doctors can prescribe medications to help lower blood sugar. The most common first-line medication is metformin. Some studies suggest it might also help protect the brain. Newer medications, which more effectively lower blood sugar, like GLP-1 receptor agonists and SGLT2 inhibitors, may also reduce the risk of diabetes-related complications, including dementia. If you're concerned about your blood sugar or risk for diabetes, talk to your doctor. There are many ways to take action, and the sooner you start, the better. Because taking care of your blood sugar doesn't just protect your body, it helps protect your brain, too. To learn more about how to support brain health at every age, visit cognitivevitality.org.